So leukocytins, these are chemical proteins. These are antiphagocytic chemicals that basically destroy our white blood cells. Okay. Other antiphagocytic chemicals that are produced by pathogens, they prevent fusion of the lysosome with the phagocytic vesicle, which is a step that is necessary in order for proper phagocytosis to take place. Okay. There's even microorganisms that are even able to survive and even replicate inside a macrophage. Okay. Survive and replicate inside a macrophage. So examples of antiphagocytic virulence factors. Virulence factors. Really, what do you mean really? What are you referring to, Joshua?
Oh, just the ability to replicate inside of the macrophage. That just
yes. Yeah. So that one, macrophage, an example of a bacteria that is able to do this is Salmonella. And we're going to talk about that in a second. So antiphagocytic virulence factors, the M protein, this is used by Streptococcus pyogenes bacteria, okay? The M protein. Another one is known as protein A, okay? This is used by Staph aureus. Also the capsule, for example, Streptococcus pneumoniae has a capsule, okay? So make sure that you know these. Make sure that you know these. You guys got these so far? Okay, I'll wait. You guys are good? Okay, so stages of infectious disease. So after an infection, the sequence of events called disease processes take place. And this basically consists of 5 stages. Note that depending on which infectious disease we are talking about, a patient can be infectious during any of these stages. Okay, so the stages include the incubation period. This is basically the time from infection to the onset of the first signs and symptoms. Okay. Prodromal period. This is a vague, generalized pre-infection period that is caused by some pathogens, not all of them. This happens before the onset of the illness. The illness is basically the most severe stage of the infectious process. This is the stage where obvious signs and symptoms are manifested. Then this is followed by the decline stage. This is when the body starts to return back to its physiological homeostasis as a result of either our immune system responding and or by taking antibiotics that start to kill the pathogen. Okay. And then finally, we have the convalescent stage. This is when this is the stage that's marked by tissue repair and physiological recovery. Okay. The classification of infectious diseases. So there's a few ways that we classify infectious diseases. Okay. One way that we classify them is the course, the time course and the severity, okay? And also we can classify them as infectious or non-infectious. So by Time course and severity, we have acute disease. This is when the disease develops very, very, very fast and it causes symptoms, signs and symptoms only for a short period of time. An example of this is the common cold. Chronic, this is when the infectious disease develops very slowly and it can reoccur later on. For example, tuberculosis does this, okay? Subacute, this is a duration and severity that is somewhere between the acute and the chronic, okay? And then finally, latent, this is when the pathogen remains inactive for long periods of time before it starts to produce obvious signs and symptoms, as what happens with herpes. Okay. We also classify infectious diseases as communicable and non-communicable. Communicable infectious diseases are the ones that are contagious. Non-communicable infectious diseases are the ones that are not contagious. An example of a communicable infectious disease is measles. Examples of non-communicable infectious diseases are these are the types that arise from outside the host, or they can also arise from the normal microbiome. Examples of non-communicable includes acne and tooth decay. Okay, acne and tooth decay. I want you guys to know that acne is caused by a bacteria. Most commonly, it's caused by a bacteria called propionibacteria. Okay. Tooth decay. This is caused by Streptococcus mutans, which is a gram-positive bacteria. Gram-positive bacteria. Okay. And Streptococcus mutans, this causes the presence of lactic acid. So it secretes lactic acid. Okay. Lactic acid that plus the presence of sucrose, which is a sugar, can cause disease. So it needs sucrose in order to cause tooth decay. Okay. Lactic acid and sucrose. Without sucrose or sugar, it cannot cause tooth decay. So basically, if you know anybody that has never had any dental decay or plaques or tooth plaque or whatever, it's because they just never eat candy in their life. Okay. Infectious dose. Infectious dose, this refers to the number of microbes that is necessary in order to cause and establish infection. This is recent research is showing that infectious dose is actually directly related to COVID-19's ability to actually cause the disease COVID-19. Also, infectious dose is correlated with the severity of COVID-19. Okay, the higher the infectious dose, the more severe the COVID-19 presentation is. So infectious dose is obviously a very important factor. Okay, how is disease distributed in the body? How is it distributed? Okay, so diseases can be can remain localized. Okay, diseases can remain localized. For example, what happens with boils that are caused by Staphylococcus aureus. Diseases can also, through virulence factors, can spread to distant sites, like what happens with Lyme disease. Lyme disease can actually spread to the brain, and it can even, from the skin, it can spread to the brain and other organs. Okay. The word bacteremia refers to basically bacteria circulating in the